Well, so as you see, today we are starting the new unit of just the book we are working with, lesson 1, and here is the first slide of the presentation. Do you see it?
Yes, ma'am.
Okay. So let's make it full screen. Do you see anything now?
No, ma'am. Just that the same page.
The same page. Well, let's try to do it one more time. Now, can you see the slide?
Yes, ma'am.
Okay. Great. So, first I would like to focus on some questions that, some issues that we dealt with in the test, the midterm test. Do you see the first page with test analysis title?
Yes, ma'am.
Okay, good. So this is one of the mistakes which were one of the typical mistakes which were made by just several students. Here the task was to put the instructions in chronological order, and there were 5 stages, first steps, and everything was okay, but about succession of such action as washing your hands and gather all needed supplies. So some of the students decided that you should first gather all needed supplies and then should wash your hands. But I think that you should touch all the supplies with the clean hands. So it's better to wash your hands first. It should be step number 1, and then you should gather all needed supplies, step number 2. That is why you see that it's marked with the a red cross, and it shows it's incorrect, but your answer is partially correct because there are more correct stages marked than incorrect. That is why so those students they've got their points for this question. Well, as for the next, so the next question is simvastatin affect the liver, but it not happen in your case. So when we were speaking about the use of modal verbs can and may, we emphasized that may is used when possibility is stronger. And here in the first case, this medication affect the liver, but so it means that the possibility is not very strong. That is why it's better to use can here in the first part of the sentence, and then we say it may not happen in your case. We are sure that it will not happen. That is why it's better to use may in the second part of the sentence. Well, then if we move to the next slide, there is a definition of a word here, which is a process whereby the doctor and the patient cooperate in the prescribing process to maximize the taking of medication. What is it?
Concordance.
Concordance, yes. It was one of the last topics that we discussed. As for consent, yes, this is also the agreement between doctor and patient, but the agreement that the doctor gets from the patient about some kind of procedure, serious procedure, interference into his body. And here, everything is about prescribing. So prescribing a medication. Well, here, yes, this is the description of one of the instructions that the doctor gives to a patient. And here, everything is possible, actually, because the doctor asks a patient to cough, to keep, to turn. But we should pay attention to the structure of the sentence. Here we have dash, and then we have still. So which word collocates with still?
To keep.
Keep, yes. That is why we should have chosen to keep. I'd like you to keep still for me. Okay. The same about modal verbs in some people. The tablets make them feel drowsy, so be careful. So it means that they will make you feel drowsy for sure. The possibility is strong, that is why it's better to use may here. Well, so the time in the procedure and the observer are chosen solely by the trainee during the DOPS. So there was the article about DOPS, and here it's given in Russian, but this is true, false, correct, incorrect, yes? So, yes, is it correct or incorrect? So when we were reading the article, we read the article about the OPS, and so the trainees, they can choose the observer, and they can choose the timing, then they can also choose the procedure. So this statement is correct. This is true. Well, it means that you should also revise the articles, the texts that we read before in our classes. Okay, so the next is also about definition. No, it's not definition. This is the use of a word in a context, and there is a statement here. He is overweight due to poor eating, and we see when we see overweight, we think of obesity. That is why a student marked obesity. It's connected with overweighting, but so we should look at the structure of the sentence. And so here we have the phrase poor eating what?
Habits.
Habits. Sure, yes, habits. Poor eating habits. Habits should have been chosen. Okay. Well, the next is about phrasal verbs. When we were speaking about separable phrasal verbs and inseparable phrasal verbs, here is the example of a separable phrasal verb, which is pick up. And so it can be used, we can use something, a noun, for example, between a verb and particle. We can use a pronoun also between a verb and the particle. But if we use a pronoun, it should be used between a verb and between the verb and the particle. We can't use a pronoun after them. It should be used in between. That is why, so we say, they'll pick John up from the airport. It's okay. Pick John up. Then pick up John. We can use John after the phrasal verb. Then the last sentence, they'll pick him up from the airport. Yes, the pronoun is used in between. And this usage, the letter C, he'll pick up him from the airport, it's incorrect, because him should be used between pick and up. So the wrong sentence is C. The next question is also about phrasal verbs, just about the meaning of phrasal verbs. The immune system enables the body to do what with the illness? Hello.
Fight off.
Fight off.
Fight off illness, you're right. Okay. Well, then there is also phrasal verb. To get an illness from someone is to pick it
up.
Pick it up. Yes, pick it up. To get some infectious illness, for example. Yes, and here is the example of active and passive voice. We should differentiate between them. She schwabbed to clean the wound.
Used.
Used.
Used a schwab. This is active voice, so we can't use is used. We should use the active voice. But if a student I see that a student chooses use because this is present simple. But if it is present simple, we should add s. She uses. So there is no s. That is why we choose the past simple used. Well. Also the active passive voice statement. Normally patients a leaflet about the procedure. So, are given, of course, because the doctors or nurses give them. The patients don't give a leaflet to anyone. That is why we should have chosen are given here, the passive voice. Well. The next is, if you continue the treatment, your rash should what will happen to
Clear up.
Clear up.
Clear.
Yes. So we discussed the meaning of this phrasal verb in our class. The rash should clear up. Yes, and the final here task is connected with the meaning of abbreviations. I was surprised because it was rather obvious the meaning. I mean, so TT to tablets or PRN when required, so there were two meanings, and it's impossible to use the definition, one and the same definition twice, when required. So it's clear that you should have chosen something different. So stat stands for status, right? And it means immediately, right? And OM stands for omni-man, and it means remember, morning. Yes, in the morning. Yes, this is the meaning. Okay, so do you have any more questions on test?
No, ma'am.
Okay. So, and are you happy with the final score for midterm?
Yes,
Somebody are happy, somebody are not. See, but most of the scores are okay. Yes, this is excellent. Okay. Good. Well, and so today, one more just. There are some comments on the homework that you have also done. I mean that you remember that the task in homework, they were to choose the correct option which are given to the statements, and they are also modal verbs. And here is the statement 3 from the home assignment. Where is Anna? I don't know. She be at the swimming pool or in the park. So some students have chosen should. Yes, should can be used when we want to express possibility, but should is normally used for future possibility when we speak about future. For example, Asna should be here before 7:30. She left office at 6 o'clock. So she will be here. Yes, so the future action. Or should is also used to talk about past events that did not happen. So here, like have plus past participle. And the example, you should have asked my permission before using my computer. It was necessary for you to ask my permission, but you didn't do that. So this is the meaning of should, which is used with have and past participle. But here we are speaking about present situation. Where is Anna now? I don't know now. That is why it's better to use can. Yes, which shows the possibility of location of the person in different places, and we are not sure about this. Yes, that is why can is better. Well, as for this statement, so it was number 4. I wonder who wrote that letter. So about Jim have written it. The possibility of the fact that Jim did the action. So could is possible to use here. I wonder who wrote that letter. Could Jim have written it? This is the question. So could is used with the past participle. Or is it participle? Jim have, no, this is have written. It can be infinitive. But yes, to have written, yes, it's infinitive, not participle. And so if we use it is possible that like some of the students have chosen this option. It should be, it is possible that Jim has written it. And here has written, this is the present perfect tense. And if it is the present perfect tense and we speak about Jim, we should use the auxiliary has, not have. That is why this option like it is possible Jim have written it is incorrect. It should be has. So we should use could here in this sentence. Well, and number 6, be at school or at home. Also, there are 2 options, at school or at home. That is why it's better to use can. Some of the students chose possibly. If we use possibly, we should just change the form of the verb to be. He is possibly at school or at home. It should be is, not be, like infinitive. That is why it's incorrect. It's better to choose can. And number 7, this work be done tomorrow. We can choose this work may be done tomorrow, or this work has to be done tomorrow. So both are possible. Okay, is everything clear about the homework?
Yes, ma'am.
Okay, good. Well, and yes, today we're going to speak about lifestyle, and here on this slide we can see a set of pictures, and the task is to match each statement below with the most appropriate picture. So the first statement, so which picture does it match?
C.
Picture C.
C, ma'am.
I can't live without my cigarettes and drink here. Yes, picture C. What about the second? I wish I could stop snacking.
First one, ma'am. A picture A, ma'am.
A. Picture A.
And what is she doing in picture A? What is she doing?
She's
Eating
having
snacks
while
while doing
having
something on
snacks.
the laptop.
doing while doing that.
Yes, she's working on computer, and so she's like busy, and she's just her lifestyle is sedentary. She doesn't move a lot and eats a lot of junk food like here. And what is she eating now?
French fries.
French fries, okay. And well, this statement, I feel eating healthy food will help me fight an infection. This is picture. Picture B. And what kind of food is there in her basket?
Vegetables and
and
fruits.
Vegetables and fruits.
Fruit and vegetables. Okay. So, well, and there is another set of pictures here. So the statement, one of the statements is, when I exercise regularly, I feel healthy.
Picture F, ma'am.
F, yes. So the person is happy because he is doing some kind of physical activities. Well, then I can't see anything wrong with eating fatty food. I've never been sick in my life.
Picture D.
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 What are they eating there?
Pasta.
French fries.
Maybe.
D.
D.
Steak. Eggs.
Yes.
They're eating something non-veg also. Non-veg too.
Then potato
Turkey.
smash.
Sausages.
Sausages.
Okay. And yes, some of the food is rather fatty here. Well, and the next statement is, I'm worn out and it's making me ill. This is picture.
Picture E.
And where is the person here in picture E?
In the street, on the streets, ma'am.
And
In the streets.
why do you think he's worn out?
After
Because
his
of
job, maybe
work.
the office stuff.
His job is tough. Okay. So he works hard. That is why he is worn out. Okay. And so the question, are the attitudes of the people in the statements positive or negative?
Some are positive and some are negative.
Which are positive?
F, B,
Okay. And so what do you think about D picture? Is what does the person feel? What's his attitude to what he's doing?
negligence. Here, that person feels that eating unhealthy is not. The person currently doesn't have any issues of eating by eating unhealthy food, so he feels that it is not necessary to avoid it, or he feels negligence about the consequence that can cause by eating fast foods or
Yes, he feels it's it won't harm his health, right? Okay, and so you see. Here, if we move to the next slide, there are more questions. So if we see if we have a look at the those pictures which describe some unhealthy actions, some activities, what are the illnesses the people in pictures might be predisposed to? So here, when with a sedentary lifestyle and eating a lot of junk food in an office, what kind of diseases, illnesses are connected with this lifestyle? What do you think?
Can cause
Obesity.
cardiovascular diseases
Obesity.
because of cholesterol or accumulation of cholesterol in the vessels. And it also has a chance of increasing the risk of obesity.
Hypertension, diabetes,
Liver cirrhosis due to consumption of
heart,
alcohol.
heart diseases and all.
Well, and what about picture C? So I mean, if people smoke,
It affects lungs,
Lung,
infections in the lungs,
lung,
and infection, and decrease the surface area of alveolus of lungs.
heart and
And
lung.
it causes liver cirrhosis due to consumption of alcohol.
exactly.
Smoking
Yes.
can lead to lung cancer also.
Yes, and liver cancer maybe. Okay. Yes. So we know you are as doctors, and a lot of people know about the consequences of such lifestyle. But is it easy to change people's lifestyle habits?
No, ma'am.
No, ma'am.
Why?
It's hard.
Why is it not easy? Why is it hard?
Because that person is used to that living in that to live in that habit for a long time. So for example, we can say if a patient is addicted to drugs, they need rehab through medical conditions also, so so that they can recover. There will be so many withdrawal symptoms while they stop that habitual work which they have been doing.
Exactly. Okay. So, but anyway, the doctor should try to help to advise these people to change their lifestyle. And what do you think are the best ways to encourage people to change their lifestyle or eating habits or these harmful habits? What should the doctor do?
Taking small steps at a time rather than greater changes, so they can cope up with their lifestyle. So small changes can lead to further greater changes after a while. And also medications will be also useful.
Okay.
We should create a goal for them. We should create a perspective for them so that they have a willingness inside them to change that particular habit of them for their betterment. If there is no goal or there's no motive for them to bring up the change, there will be no use of that. So they should have a motive for that first.
And actually, advice is not possible, but still, we must give some motivation to the people and tell them about the seriousness after causing such diseases. So there are chances for some people for changing their lifestyles too.
Okay, yes. Well, it's great that you understand what to do in this situation. Well, and so if we move, can we move? Just a minute. Here.
Unit 6.
A minute. When just to help patients change their lifestyles, it's important to know something about their family and social history. So otherwise, any encouragement to change may not fit in with the patient's lifestyle. That is why the doctor is just asking some questions about lifestyle. Now we are going to listen to 3 extracts from the conversation, and we should decide whether the doctor is asking about their family history or social history. So please make notes about this conversations and tell me if you hear or not.
Unit 6. Listen.
Can you hear?
Yes, ma'am.
Okay, now please.
Unit 6. Listening 1. 1.
What about work? Do you have any problems there?
At the moment, yes. It's a bit stressful.
And can you tell me a bit more about this?
Well, I'd say it started about 2 months back. A colleague resigned and he wasn't replaced. so I'm kind of doing 2 jobs at the moment.
2.
Are your parents still alive and well?
My mother is, but my father died 3 years ago.
Do you know what the cause of death was?
It was lung cancer.
3.
Do you smoke at all?
Yes.
How many do you smoke normally?
I'd say about 20.
When did you start smoking?
I had my first cigarette when I was 15.
15. Okay, and have you ever stopped?
Yes, many times.
When was the last time?
I quit last year, but it only lasted a month.
So the first conversation was about family or social history?
Social history.
Social history.
Social history.
So the second,
Family history.
Family history.
Family.
and the third about smoking, is it family or social?
Social history.
Social, yes, because this smoking interferes the lives of other people. That is why it's social history. Okay, and
Unit 6.
now we'll listen for the second time, and the task here is to write down in note form the questions that the doctor asked in each case. So please take notes while listening.
Unit 6. Listening 1. 1.
What about work? Do you have any problems there?
At the moment, yes. It's a bit stressful.
And can you tell me a bit more about this?
Well, I'd say it started about 2 months back. A colleague resigned and he wasn't replaced, so I'm kind of doing 2 jobs at the moment.
2.
Are your parents still alive and well?
My mother is, but my father died 3 years ago.
Do you know what the cause of death was?
It was lung cancer.
3.
Do you smoke at all?
Yes.
How many do you smoke normally?
I'd say about 20.
When did you start smoking?
I had my first cigarette when I was 15.
15. Okay, and have you ever stopped?
Yes, many times.
When was the last time?
I quit last year, but it only lasted a month.
Okay, so who can just read the questions that the doctor asked in these conversations?
First one is what about work? Do you have any problem
And
there?
do you
Problems
have
there?
any problems there? And
Next
second
question
question,
was, and how can you tell me a bit more about this?
Okay.
third one is their parents still alive and well.
So
And
this is in the
Do
second
you know what
conversation.
the cause of? Yeah, do you know what the cause of death was?
Okay.
and in third conversation, doctor asked, do you smoke at all? And how many
And
do
how
you smoke normally?
How long? When did you start smoking?
And
Okay.
when was the
What
last time?
Okay, yes, that were the questions. And which tenses are used in the questions? Grammar tenses. I mean, when the doctor asks about the present condition, the present situation, so he uses, of course, present simple, right? And when he just asks about the family history, so he used the past simple, and also the past simple tense when he asks about smoking experience. And in this question, how long have you been smoking? So this is the perfect tense is used. So do you hear me?
Yes, ma'am.
Okay.
Yeah.
I see. Good. Well, and
Unit 6.
yes. And here is the task. So speaking about family history or social history, so the doctors should learn a lot of just details and information from their patients. And here are some examples of other questions that a doctor can ask his patient. So the doctor can ask about home, occupation, hobbies, alcohol, money problems, and changes in habits. Why is it important to ask about home?
Because if he is affected,
Sorry?
Do you know the condition in home?
Are there any other people that the person lives with? Maybe yes.
And if someone is, if some children is affected due to parents, if some parents are drinking or smoking, the same will be repeated by the students or the children. So the same is asked by the doctor.
Yes, okay. Why is it important to know about occupation?
To know whether it is an occupational disease or due to the occupation, if the person works in a mine, the person may have allergies and also respiratory problems. So what if the disease is connected to the occupation or not? For that, the knowing of occupation is really necessary now.
Yes, how stressful the situation is at work. Yeah. What about hobbies? Why are doctors interested in patients' hobbies?
If the person is
This would be related to their hobbies. For example, if a person is has a hobby playing golf, there will be pain in his hands, so it will be easier for the doctors to see the condition if it's because of the hobbies. So it's good that the doctors ask about the hobbies.
And anyway, hobbies just help to relieve stress and to relax. So if they are not, if they are healthy. Okay, so we have less than 1 minute. That is why we should just take a break